in a transformative step toward advancing community well-being. Chiamoh Mental Health a Priority, a grassroots civil society association founded by individuals with lived experiences of mental health challenges, officially launched its activities here in Mmuock, Leteh, a village located in Wabane subdivision, southwest region of Cameroon. The event marked the beginning of what promises to be a far-reaching, life-changing initiative, taking the form of a mental health awareness campaign. The event focused on enhancing mental health literacy, promoting stress management, particularly among women and youths, and dismantling stigma and discrimination surrounding mental illness. Hosted at Divine Mercy Parish, a venue chosen for its accessibility to all members of the village, the event attracted a diverse and engaged audience. Participants included traditional authorities, religious leaders, health professionals, youth representatives, and community members from all walks of life. The goal was to equip the local population with vital knowledge about mental health conditions, encourage early intervention, and foster a culture of mutual support.
This event marks a historic day for mental health in Mmuock Leteh village, Wabane subdivision, Leteh division, southwest region of Cameroon, and an important day for all the 4 Mmuock villages and all rural communities in Cameroon. Chiamoh Mental Health Our Priority is a civil society association of people with lived and living experiences, advocating and targeting mental health and stress management in women and young people, and bridging the communication gap between national, continental, and global initiatives and academia for health for all through a public health, human rights, multi-sectoral, and multi-stakeholder perspective. This official launching is grounded in our lived and living experiences. For example, as the founding director, I have had adverse childhood experiences, anxiety, depression, burnout, suicidal ideation, and had my elder brother suffer from schizophrenia for many decades without appropriate care nor awareness, stigma, discrimination, marginalization. We are out to foster prevention and ensure that no one suffers without adequate knowledge, support, and care. We are impressed by the population's enthusiasm and pray for more collaboration with health professionals, multi-sectoral partners, funding sources, government support for more healing, productivity, development, and a mentally healthy world.
Distinguished speakers enriched the session with insight and experience. Among them, Mafo Julia Fotang, representing the village chief Fotang the Seat, Reverend Levis Asong Lefak, parish priest of Divine Mercy, youth leaders, community health workers, and notable women leaders. Each speaker emphasized the importance of addressing mental health challenges as a matter of urgency and humanity. In his compelling keynote address, Reverend Levis Asong Lefak called the campaign a beacon of hope for the village. He spoke candidly about the rise in mental health struggles among his parishioners, citing marital challenges, pace of modern life, and a weakening sense of communal care as major contributors. He commended Chiamoh's initiative as both timely and necessary, pledging his full support and spiritual blessings to the team.
I received this team headed by the director, Madame Seraphine Chiamoh, talking about mental health. I think this is a wonderful initiative, and as the parish priest of this parish, I buy this whole idea wholesale because it's actually what, in fact, it is timely. It's actually what we need, what our people need. When you look at the community where we are, you will discover that we have a lot of these issues here, and a greater percentage of the people here Christian and non-Christian alike, suffer from this whole aspect of mental illness, flowing from trauma, flowing from psychological difficulties. There are some that are even living with mental difficulties and they are not even aware. Some flowing from marital background and all those kind of things. So I'm really happy, and I was when she spoke with me, I told her I was very happy about it. And when they finally came today, I said thanks be to God, because this sensitization and reaching out to people, those who are suffering from it, those who know those who are suffering from it, and those who they are able to support the initiative to see how we are able to together as a team remedy this situation. I think it's actually very wonderful, and I want to commend her effort and the team she came with. I want to really salute their effort. Today we are doing the launching, and you will see that even though with the poor road and the poor weather, they were able to get here. So I'm really very happy, and I can only pray as a priest that may God bless this initiative and cause this initiative to grow to higher heights.
I shall not be a source of distress to my neighbors.
The campaign's message struck a profound chord with the audience. For many, it was the first time they felt safe to speak openly about mental well-being. Several community members described the session as eye-opening and empowering, expressing a strong desire for continued engagement. Many called for the rapid return of Chiamoh, underlining the urgent need for sustained mental health support in the area, which has also been affected by the socio-political crisis.
We're really happy and glad, and we want the Chiamoh to take us to a higher height, the Mmuock Leteh, with the mental health. To that effect, I join my hands together with Chiamoh to say no to stigmatization. I would also want to encourage the Chiamoh to include in their activities schools.
Importantly, the campaign also created space for villagers to voice broader concern about health and development. Among the issues raised were a lack of consistent health education, the visible impact of climate change on agriculture, poor road infrastructure affecting market access, rising numbers of school dropouts, increased interpersonal conflict, and family tension. As Chiamoh continues its journey, it calls on all partners, local leaders, health professionals, development actors, and well-meaning stakeholders to join hands in building a healthier, more empowered future with sustained engagement and unity. Mmuock Leteh can become a model village for mental health advocacy and holistic development in Cameroon.